Zlada wants rhinoplasty to reshape her nose.
Most Bosnian women have sort of that small, dainty little, button nose, and mine sort of has that, the hump.
But is Zlada's nose really a problem? Or is the problem that her nearest and dearest think it doesn't measure up?
It's just unsightly, and I hate it.
25-year-old Zlada is constantly comparing herself to her Bosnian social circle. Zlada wants surgery to change her nose because she feels she doesn't meet up to her culture's beauty standards.
That's great, actually. I like that.
Our community tends to be very image-oriented. They're very done up. Everyone's perfect hair, perfect makeup, perfect clothes, and, for the most part, everyone's got a perfect nose. And I sort of feel like I stand out in a way that I don't want to stand out.
In Bosnia, a bigger nose usually means, from a lower end, of the food chain.
I hate this bump here. It's just bothers me. It's unsightly. It's a little long too, so I'm kind of hoping to get it just a little bit shortened up. I was not teased per se, but I did hear a few comments of, you're a really pretty girl, but you do have that nose. And I'm just like, okay, that sort of stays with you. It doesn't leave. It's like, yeah, you're pretty, you're all great, but you do have that nose.
Zlada feels her appearance separates her from her Bosnian friends, and she's willing to undergo surgery to fit in.
Socially, it's just, I don't want to clam up in a shell, and I do sometimes.
I need to sort of move on with my life and get past this obsession that I have.
It's hard when you're constantly aware of something on your face. It's almost as if there's a big piece of spinach in your teeth and you're talking to people and it's there, but you can't do anything about it. And they're looking at it. Like, it is so hard. It's exhausting to be aware of my nose at all times. I just want to put it to rest.
Dr. Philip Solomon is a board-certified facial plastic surgeon practicing in Toronto. He'll be preparing Zlada today for surgery to reshape her nose.
Come on in, relax. So we're going to go over everything again today.
Okay.
I think we've decided that the biggest features that we're hoping to change are the bridge here. Mm-hmm. We're going to remove this little bump on the bridge.
Yeah.
We're going to lower the entire bridge from the top all the way just above the tip here.
Okay.
And then finally the tip of your nose, this area here, the fleshy part, we were hoping to reduce slightly.
Okay.
This is our team we have here.
To reshape Zlada's nose, Dr. Solomon begins by removing cartilage that makes her nose appear bulky. He then removes the bump from the bridge of Zlada's nose. Cartilage is reshaped and replaced into the tip of Zlada's nose to give it support. Finally, bones are broken on each side so that the width of Zlada's nose can be narrowed. Surgery to change Zlada's nose took 90 minutes. What does Dr. Solomon think about Zlada's potential outcome?
The surgery went fine. It was exactly as predicted. I think that she'll have an excellent result. I was quite satisfied with the operations.
What I see now when I look in the mirror, I see a confident person. I see somebody who's not obsessed with a single facial feature and someone who doesn't feel that everybody's only looking at that.
Has plastic surgery helped Zlada fit into her social circle?
I now finally feel as if I do fit into the glamorous Bosnian community. Everyone loves to dress up, everyone loves to look good. It's just our European culture is how we are, and I finally feel like I fit into it 100%. It makes me so happy to just be able to throw on my favorite sunglasses now and know that they look good, and it's just such a liberating experience.